Are you looking to transition into the corporate world from being a bedside nurse or other healthcare professional? Nursing careers can take you to pretty creative places beyond the bedside, although sometimes a scary transition into the unknown. Certain specialties such as critical care, cardiology, emergency care, wound care, and diabetes education can actually uniquely position nurses to be very valuable to many medical device companies. I speak to numerous clinicians each week looking to make a transition into the medical device industry, so I wanted to share some trends that frequently come up when discussing the traditional clinical specialist or educator role, and highlight some key interview tips that will help you along the way in pursuing this career path. There's a few things you'll need to be comfortable with and capable of doing as a clinical specialist, also referred to as a clinical educator, clinical consultant, or clinical education specialist. These roles are quite perfect for nurses who want to be an educator, learning, presenting, instructing, rather than being solely responsible for direct sales, although always a career advancement opportunity should the skill set or desire arise. 1. Be prepared to be mobile. An element of tech savviness is needed when you're on the go, working remotely, creating educational content, or preparing to present to physicians and other key staff. Don't be afraid to speak up and show your personality. Being able to present to a room or take charge of an OR is essential when educating and advising on how to use certain products and the correct application and safety of the devices in the clinical setting. You're the advisor to your physicians. Travel is the norm. Clinical specialists are mobile and flexible positions, so expect to spend significant time traveling locally, regionally, or nationally. You'll need to be self-disciplined and self-motivated to really plan your schedules accordingly and be flexible and open to changes. Regulation is also regular. Since healthcare is heavily regulated by the federal government, these positions often require regulatory reporting and audit duties as well. Be familiar with any regulations pertaining to your device, medication, or equipment you will be representing. I think it's also super important to note some key common interview tips if you're looking to actively pursue a clinical specialist role and move into the corporate world, if you will, with a med device. This varies greatly from healthcare interviews and is highly competitive. 1. Plan to re-up your resume. Be specific on each clinical position you've held. What did you do day-to-day in the ICU? What procedure types have you assisted with in cath lab or interventional radiology? What did your role include as a charge nurse? And how many people did you supervise? What did you supervise? 2. Always dress professional. Suit and tie, blazer for women, closed-toed shoes, etc. Dress your best and to impress. You do not want to miss out on a great opportunity simply because you showed up with a wrinkled shirt, no tie, or open-toe shoe. Lastly, follow-up goes a long way. Always be sure to send a thank you email after each and every interview. Be thoughtful and highlight anything in the interview that was important to you about the role. I hope this overview of the traditional clinical specialist role and tips on interviewing will help you understand what to expect and how to land your next dream job in the industry.